So let's start with looking at the consumer protections that are included in the Affordable Care Act. And I think the best way to approach this is to see what was going on prior to this. So people who had already had a medical disease, like let's say this guy here who's got a bad heart, he has a pre-existing condition. And because of this disease, he's going to be more expensive to the health insurance companies because he's going to need more care. And so he would frequently be denied coverage because he'd be too expensive for them. And so if this person had a job and had insurance there, he could never leave this job to go to another one because when he'd go to that other job, they would deny him insurance, or if he gets fired, he'd be denied insurance. So this pre-existing condition would prevent him from getting insurance. Now, this person over here is in the hospital and has expensive health care. Maybe this person has cancer, and over the course of their life has been getting lots of treatment, which also has been expensive to the health care insurers. So what they might do to save costs is say, hey, you've reached your lifetime limit, we're not going to pay anymore. Or even they could just say, we're going to drop your insurance. And that was called rescission. Now, what effect this has is you still have medical bills accumulating because your cancer is not gone, but the insurance companies are no longer going to pay because they've either said you reached your limit or dropped your insurance. You're going to accumulate bills, and you're eventually going to go into bankruptcy because these bills are going to be expensive and you might not be able to pay them. Or you may have been sold a bare bones policy that barely has anything. Look, this policy here is in tatters. So when you get hurt, maybe you break a leg and you have to go to the emergency room and you need surgery, and you go to your insurance, they'll say, that's not covered. Sorry, you got to pay for that on your own. And so these policies, while you're paying for insurance, really don't cover that much. Additionally, there was some discrimination in these policies. So women would frequently be charged more than men because they do tend to use the healthcare system more often. So the insurers justified this, saying we should charge them more. And also old people got charged more, a lot more. So there was discrimination in these policies against certain groups. So the Affordable Care Act aimed to address each of these. So no longer can you be denied health insurance just because you have a pre-existing condition. So this is gone in favor of guaranteed issue. You're guaranteed to get a health plan, regardless if you have diabetes or a heart condition or whatever. Now, if you were sick and previously you might have, they would have dropped you from the insurance, they can no longer do that. There's no more rescission. Additionally, they cannot have a lifetime limit on the amount they would have to pay out. In fact, they have to tell you what your maximum out-of-pocket costs can be. So you will know from the beginning what is the most that you could possibly have to owe, and then you could save accordingly for that. You won't be surprised with a gigantic bill that you cannot pay that's going to put you into bankruptcy. Now, regarding these bare-bone policies, those are not allowed anymore. Each one has a minimum standard, these essential health benefits, which we'll talk about later. So you're not going to have a bare-bones policy that is really cheap but really doesn't cover that much. Now, where this has become an issue lately is in President Obama's declaration that if you have your policy and you like it, you'll be able to keep it. That's not exactly true, because if you have a bare-bones policy and for some reason you like that, probably because it's very cheap, you won't be able to keep that. You're going to have to drop that because they're not going to be allowed to offer that anymore. It has to cover these essential health benefits. And this includes things like ER visits, preventive care, and mental health care, as well as substance abuse care. So it does have some basic health benefits that it has to carry. If this didn't cover it, you may have to lose your policy in favor of something that is more expensive. But for most people, they'll be able to keep their policy as long as it meets those requirements. And finally, the discrimination is no longer permissible. And so you can't discriminate against someone because they're a woman or because they're old. In fact, women now are going to have access to gynecologists as well as birth control pills. And more importantly, the insurers cannot charge a woman more than a man with the just because she's a woman. And in the past, The elderly could be charged 10 times or even more that of a young person. Now, this is limited to only 3 times. So the elderly cannot be charged outrageous premiums either. In fact, the only 3 things that can determine the cost of a particular policy, sorry, I said 3 things, but the only things are age, so that you can charge more, but not much more for elderly people. It's whether you smoke or not. Where you live, certain areas are going to be more expensive. How many people in your family you're insuring, of course, the more you insure, the more they can charge. And the percent coverage that the insurance is going to give you. See, if they only cover 60%, it's cheaper than if they cover 90%. So these are the only things that are going to determine the cost of your premiums. So this is a broad overview of the consumer protections that are provided by the Affordable Care Act. The guaranteed issue, the inability of them to drop you or impose lifetime limits so you know what your max out-of-pocket costs are so you can save for it. You can't have a bare bones policy. You can have essential health benefits. And no more discrimination based on gender or based on age, really also based on pre-existing conditions. These are the only things that can determine premium prices. So obviously this is going to cost insurance companies a lot more to provide, right? Because they got to pay for this guy's expensive health care, this person's expensive health care. They got to pay for the extra coverage that comes with these essential health benefits. And they got to pay for whatever extra health needs these people might need. So how are the insurers going to make any money? Well, we're going to look at that next, and that comes through the mandates.